Hello, dear colleagues, and we continue our course about intelligent support, decision support systems, and intelligent systems in healthcare in general. And today we will talk about medicines, quality measurements, and how we can improve them. And to gain some insights in regulations of healthcare products, we will need to go through the life cycle of registration and to understand how the regulations of prescription drugs supply and price control take place, and also we'll understand the role of patients, branding drugs, generic drugs, how insurance coverage are formed and how they are linked together, and what methods could be used to assess them, and how we control quality of these products and services provided with them. And first of all, we will need to specify what are the types of products and equipment which we are using. Medical equipment could be specialized equipment that is designed for medical purposes, and it's determined in different ways, and different countries define this medical equipment in different terms. For example, in some cases, equipment is considered medical if it comes into contact with a patient in the course of medical care. Another type will be image processing equipment. These will be radiological equipment, ultrasound machines, tomographic computers, as well as specialized computer systems for data storage, so-called PACS solutions. And another type will be biological products. Of course, it will be medicines, and the use of most of these products and equipment is regulated on some level in each state. So let's start with medicines. They are substances intended to diagnose, treat, mitigate, or prevent diseases. The main group of drugs are prescription medication. These are medications that require a prescription to be used by a patient. Another type will be over-the-counter medications, which we can buy by ourselves in pharmacies. And these medications do not require a prescription from a doctor. As a part of the approval and regulation process, both prescription and over-the-counter drugs are overseen, but the processes may vary. More often than this process will be more complex for prescription drugs, and so the level of control for prescription drugs is in some way higher. And of course, most of the attention to the medications will be addressed to the prescription drugs segment. And overall, the time for the creation and the release into the circulation of a new medicine will be from 8 to 10 years. And this lengthy and extremely expensive procedure is connected with lots of activities related to creation of new molecule, registration, and there will be billions of dollars involved in this process to make it possible to address all these regulations. And of course, regulators will continue to monitor medicines once they are introduced into market, and this is required to assess their efficiency. And the regulator can address his controls into labeling, manufacturing process, and other aspects of the manufacturing procedures. And of course, it will be controlling selling procedures for these medicines. And the process of regulating the use and control of the dispensing of medicines are specific in each country. They usually involve a series of mandatory steps which include studies and trials and will vary for different levels of coverage. Objectives of the research in these controls will be, of course, to assess drugs' activity and safety. Basic definitions of whether a drug is safe for humans will be provided during these examinations. Another activity will be to design a certain dosage and route of administration for this drug to be effective. And further, there will be required a lot of investigations to define what are the side effects of this medical product to be used. And overall, we will need to define and confirm the safety, efficiency, and long-term side effects for each medical product to be open to the market. And another activity will be to compare one drug with another to define which alternative will be best for the patient. And of course, we can compare not only different drugs with each other, but also different types of therapy. We could compare surgery with, for example, conservative treatment with medical drugs. When using medicines, it's important to distinguish between branded drugs and generic drugs. Branded drug is a medical product sold by the manufacturer who was the first to introduce this exactly drug substance or combination of substances to the public, and they will own the trademark and patent for this medical product. And generic drugs are produced by multiple manufacturers after the patent was expired, and this molecule will be open to be produced by each company which will be able to prove that they are able to manufacture this medicine. And of course, you can imagine that branded or drugs protected by patents will be much more expensive for the patients. And this will be actually the novel drugs in general. Along with the regulatory process, a new idea of creating a drug can be considered an invention, and also it could be patented. When an inventor patents his invention, he gets the right to be the only one who sells the invention for a certain period of time, which can be called market exclusivity. Along with the this market exclusivity will be a significant boost for this manufacturer to be able to cover his expenses for designing this new molecule and to produce this new medical product. So this new drug will be placed on the market under the certain name. That's why it's being called a branded drug. They are sold as a specific product, which tend to be more expensive than generic medicines. When a patent will expire, other manufacturers will be able to figure out how to make a drug with the same formula. Uh, and after that, they will start to produce and sell the same generic drug with their own generic names. Here's one important point to note is the impact on the price associated with the advent of generic products. When a drug is protected by a patent and only one seller is allowed, prices tend to be higher. Other generics enter the market, and this will increase the competition of it, and it will lead to the lower drug prices, and these price changes are often noticeable. So for the patients, this price reduction could be in several times lower than for the branded drug. When a patient is about to take a prescription drug, they need to have this prescription from a doctor or authorized healthcare provider. The general rule is that you can get a prescription drug without a prescription. To receive the medicine, the patient needs to submit a prescription to the pharmacy. Pharmacies can be wholesale or retail, online or another types. Pharmacies are equipped with pharmaceutical specialists, and they are trained to understand which medications could be provided to the patient under certain conditions, and for example they will be able to check the prescriptions from the doctors, so if they are correct, and these medicines could be dispensed. And another requirement for the pharmaceutical specialists will be to provide recommendations how this product could be used, and these recommendations are being given according to the instructions provided by the manufacturer. In some cases, patients may have insurance coverage that helps them to cover costs of, for the prescription drugs to buy them. And there may be some provisions in insurance plans that affect what medicines patients can use and how the insurer will cover them. The key concept here is the form, and under this form we will have a list of medications that the insurance company allow the patient to use for the and for this list of medications they will provide the coverage and reimbursement. And forms may vary from one insurer to another, and there also could be different levels of coverage in this form. So this multi-level formulary system will categorize drugs on different levels according to the level of coverage provided by the insurance company. And each level determines a different degree of cost sharing between the insurance company and the patient. By using these formularies, the insurer can encourage patient to prefer some drugs over other. Insurance plans may apply verification of use, such as pre-authorization, where patient need to get pre-approval from the insurer before taking a particular drug. Sometimes plans may require step-by-step therapy, uh, where the plan may require the patient to try the preferred drug before they will be able to acquire another one which is more preferred by the patient. Let's now move to such an important aspect as quality assessment. There are 6 areas of quality. Well-known quality report by US Institute of Medicine, and this institution provide a quality control assessment documentation which is often used under acronym STEEP: safe, timely, efficient, effective, equivalent, patient-centered. There are 6 areas of quality: security, efficiency, patient-centered, timeless, efficiency, equivalence. Let me remind you that the main problem of healthcare is either overuse, underuse, or misuse of medical services. This happens when the health system either use too many health services, not enough health services, or uses the tools at their disposal in the wrong way or at the wrong time. There is a Donabedian model, also known as a structure process result model. It's often used for quality assessment. This model was proposed in 1980s by Dr. Donabedian. It includes 3 processes: structure, process, and outcome. And this evaluation model can include both an individual and a team aspect. Healthcare is often provided by a variety of specialists and organizational structures. Of course, it's important that all specialists are well trained and quality-oriented. But it can also be important, it will be very important to make teams or organizations as well to work perfectly in this organization. The construction and the use of quality indicators has become a central component of quality improvement efforts, and we need to look at some of the main aspects of quality assessment. When we talk about quality assessment, we should always keep one thing in mind. This quality are those qualities, which qualities we are trying to evaluate. There are different levels of measurement. Quality assessment for vendor or group of vendors. Assessment of the quality of the insurance plan or intermediary. Assessing the quality of care provided to an individual or group of people. As a rule, it's the structure process result model that is often used to assess these qualities. And how this assessment could be provided. There are several questions to be answered. So, does the healthcare system have a structure that promotes quality assurance? Are there enough service providers in the right places with the right training and skills? Can equipment and infrastructure organized financed in a certain way work effectively. There are structural quality measures to be provided for suppliers. Is there a good EHR system? Can an organization confirm that it has emergency protocols? Can the organization confirm that it has protocols in place to prevent the spread of infections? Are doctors and other healthcare providers qualified to provide these services? Are the facilities properly accredited, licensed, and certified? And there are structural quality measures to assist the population. Are there enough doctors and other professionals for the population to be served? Are there enough hospital beds in these institutions? Where are they located in relation to the population? The data used to assess the quality of the structure can come from a variety of sources. Structural evaluations are carried out quite frequently. Often, when we look at different measures, it seems that more structural measures are easier to be built. At the same time, they may be by the further from the real outcomes, which is what worries us the most. Therefore, these days, quality assessment often goes beyond simple structural quality. And one of the aspects of quality assessment is in healthcare that receive a lot of attention nowadays is process measurements or process evaluation. And the basic idea here is that you have in mind the outcome you want to achieve. Then you can work to identify some of the processes that will lead to this outcome. Then you will be able to develop an assessment of these processes to track whether and how often they occur. One very common approach to evaluate a process is to determine whether generally accepted guidelines for clinical practice are being followed. Typically, this process will involve identifying a group of interest. So patients will receive a particular treatment or procedure whose benefits had been proven through research or some other methods, such as professional opinion. A method is then created to estimate and track the proportions of the population receiving a given treatment or service. You can identify these groups or interests and then query databases or use some other methods to find out whether patients in this group are receiving recommended care or not. Data can be collected and assessed if the symptom or disease is manifesting. One option is to assess the assistance and if it was provided in a required amount. Situations where the evidence suggests that a certain type of procedure shouldn't be performed also will be recorded. So process evaluation is probably the most common from the quality assessment right now, and process metrics can be created for different types of organizations to make it possible to use. There are many sources of information about process metric. Often we use EHR databases or claims into databases can be used to identify different patients and track whether they have received recommended care or not. Sometimes registered registries are being used. Registries are databases designed to collect and compile relevant information on all or at least many patients with a particular disease or patients receiving a particular treatment. Often in order to have a resource for monitoring or improving quality. One of the most important indicators of quality is the results of treatment. The basic idea is that we determine what we want or don't want to see, and if it happen or not, what will we do. How does this affect health, quality of life, or life expectancy? The outcome can also include things like changing behavior or improving knowledge. Examples of evaluation of the results will be mortality rate, readmission rate, rate of complications, potentially preventable complications, and sometimes it will be referred to outpatient hospitalization or prevented hospitalization. And another way will be patient-reported results. They will be referred to PROM, or in different literature will be different abbreviations. These outcome measures have many positive features, but can also face the challenges. One of the key concerns is the possibility that differences in outcomes from one healthcare provider or form of care from another may not only be the result of differences in actual baseline quality, but may also be the result of other factors, some of which are beyond the control of healthcare providers or other healthcare services. Depending on the situation, this can be an important factor. There could be different providers with significant differences in patients for which they will provide care and services. As a result, a good job of evaluating outcomes usually involve adjusting for risks which are connected with these patient groups. So risk adjustment will be an approach developed to correct differences in patient characteristics. It may take some real effort to conduct an integral quality assessment. Various mechanisms should be involved here. One of them is to find the right evaluation system, and assessment of structure, process, and outcomes can be useful in a variety of circumstances. And they are often useful in combination. And these evaluations are regulated under different legislations in different countries. For example, in Russian Federation, we have an approval of criteria for assessing the quality of medical care stated as a part of the legislation system. And in this document we will have the criteria which are used to assess the timelines of care and correctness of the choose, how we choose the methods of treatment for prevention, diagnostics, rehabilitation, and how we control the achievement of planned results during this treatment. And the criteria for assessing the quality is approved by this order and these laws, so we don't really have a lot of free space to choose our methods to control these assessments. In the US, there is a National Center for Quality Assurance, and this center developed a measurement system for healthcare plans, and it's called Healthcare Performance Data and Information Set, which includes a series of metrics for structure, process, and outcome. And these criteria are being used to compare health insurance plans in the US between each other. In general, quality assessment activities are designed and implemented by many different government and independent organizations. Moreover, assessment activities, quality audit, for example, can be carried out by special organizations working to improve the quality of medical services, and the providers themselves also often use them to check the quality of services and evaluate their work in the internal processes. Individual healthcare facilities are taking quality assurance measurements also. Most often, quality assessment and measures to improve it are implemented as a cycling process. We will start with monitoring, public reporting, development of incentives to correct them. Provider will address quality improvement plans and what are the measures for this plan. And assessing quality and using different measures to achieve these improvements is an important area in the healthcare system that require attention to many different aspects. At the same time, this area is suitable for increasing activity in terms of introducing innovations and holds many opportunities for further research. Quality assurance has traditionally attracted a lot of attention and require a lot of work. For people interested in data science and AI technologies, there are a number of important opportunities here. Some of the opportunities for innovation are related to the measurement of these quality controls. There are several areas of quality, both within STEEP, and they will be efficiency or safety, and in other areas such as equivalence of patients, orientation, risk adjustment, and so on. There may still be a room for innovative ways to select treatment. We can identify the best provider for the patients, we can determine the best network for the payer, we can identify the best incentives to apply quality measures. And there are also lots of other implementations for where can we contribute and where we can combine digital technologies and introduce them into healthcare system.